would like to demonstrate the administration of medication via an NG tube. We need a pill crusher with some slips for the pills, some sterile water, and an irrigation tray. First thing we need to do is to verify that all the medications are safe to be administered for the patient and that they are appropriate to the patient. So do all of the checks and do them 3 times. And note that some pills cannot be crushed, such as extended release pills. So I'm in the patient's room. I've done hand hygiene. I've identified the patient with 2 identifiers. The head of the bed is up, 30 to 45 degrees, and there's a towel to protect the patient's gown. First thing I want to do is to measure the placement of the NG tube, and it is out of the nose as stated in the documentation. So next thing I want to do is to check the placement via pH. So I'm going to take off the cap and open up the Lopez valve here, aspirate some of the stomach contents, close it off, put it on the pH strip. It needs to be less than pH 5. So I'm going to put this back on and then check gross residual volume. It needs to be less than 240 milliliters, which tells us that the stomach is working properly and it's safe to administer the medications. It is. So push it back in, close off your valve again, pull off the plunger, and we're ready to administer the medication. So open up the valve again. First thing we want to do is flush with 30 milliliters of sterile water or normal saline. Takes a little time to get going sometime. Okay, it's going in now. So make sure your medication is well stirred. Okay, so the flush has gone in. So put in your first medication. In between medications, we want to flush with 15 milliliters of sterile water or normal saline. Put that in. Make sure your second medication is well stirred. As soon as that's ready, go ahead and put in your second medication. So the final step is to flush the whole system with 30 milliliters of sterile water or normal saline. Okay, so that's the last of it. I want you to note that this is pinned to the patient's gown. That keeps from pulling this NG tube on the patient's nose, which can be very sensitive. So make sure that you have one of those in place. As the last of this water goes in, we're going to close it off and cap it. So as the water goes down, I'm closing off the Lopez valve, putting the cap back on it, put the plunger back in the syringe. So the medication has been administered. The head of the bed needs to stay elevated for an hour. It is down. The wheels are locked. The call light is within easy reach. I'm going to do hand hygiene and document that the medication has been administered.